I was initially diagnosed with juvenile idiopathic arthritis when I was 11 years old. I got really sick with a virus, and after that kind of subsided, I had all this strange joint pain occurring. It was mostly in my knees, but it started in my jaws also. So I was at my primary care doctor. They ran one test and some blood work, and they're like, there's some markers in your blood that could be, arthritis, and that came as a real shock, at 11. So my primary care doctor recommended me to go to a rheumatologist at Children's Hospital. Children's was just kind of primarily the initial diagnosis, the initial medicine, all that kind of stuff, like how to live with the diagnosis. And then my primary care doctor at Virginia Mason and at Children's kind of suggested, when I was turning 16, 17, just to kind of transition into an adult care. I'm here today to help those who are at Children's right now in the rheumatology department make the transition to an adult physician here at Virginia Mason. It's, kind of scary going from a pediatric doctor to an adult doctor, just because I knew I was gonna have to take it on myself. So to prepare for my transition, I asked a lot of questions of my pediatric provider. I asked for any information, resources, websites, pamphlets I could get my hands on.
So Laura, how are you doing today?
I'm doing good, thank you.
Good.
So that first visit was just talking about routes of care, routes of treatment, what I have done, what I did want to try, what I was totally opposed to, and he really did listen.
I think it's really important for patients to feel that they have a smooth transition to adult medicine from pediatric rheumatology. It's important because we want to make sure that patients' disease processes are completely well controlled and that we have all of the full panel of labs, imaging, and clinical history on the patient so that we can do the best job taking care of them. So I think at Virginia Mason we have a really warm, friendly, caring environment here where we have access to different clinics throughout the Seattle area, both downtown, in Kirkland, in Federal Way, as well as in Yakima and Bainbridge Island as well. We want to make sure that we're providing the best care for our patients here, and the patients are always first. We also want to make sure that we're communicating with the patient's pediatrician or internal medicine provider, as well as with all of their other specialists. So we do a really good job trying to circle back to those providers and making sure that someone has really excellent care here at Virginia Mason.
Virginia Mason is a really great place for new patients to establish care because we have lots of different services here, a wide range of subspecialties, as well as really great primary care doctors. So people can get all of their care in one place and get to know everybody, and it certainly makes transitioning to a new hospital a lot easier. At our first visits with all new patients, we usually have about 40 to 60 minutes to really have more of an extended time to get to know each other, do a thorough exam, talk about their medical history, and then just get to know each other a little bit better and establish a plan. Usually we'll do some labs and maybe some x-rays if those haven't been done recently.
Ask questions. We want your questions, and we want to know what we're doing right, what we're doing wrong. We want to make this as easy as possible for you, and so feel free to give us a call at our rheumatology clinic, and also feel free to talk with your pediatric rheumatologist about the transition process.
We're excited to meet new patients, especially our younger people who are coming here, and we're looking forward to get to knowing everybody.
The benefit of being here is everyone really works as a team. Like, my rheumatologist here has gone out of his way to reach out to, doctors within Virginia Mason who aren't in rheumatology, even doctors outside of Virginia Mason to get me the best care that I possibly can, and that's really what I love about it here. I would suggest do your research on your diagnosis, on medications, on treatment plans. Talk to your pediatric care provider, really ask them for that help, who they might think would be the best fit for you. I'd recommend around 15 or 16 to kind of start transitioning. You're kind of in the midst of high school and thinking about your future, and you need to kind of start thinking about a doctor that's going to be there with you long term.